Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. We are back on the air. As some of you know, I got COVID early in the pandemic and spent a considerable amount of time on a ventilator in the hospital and rehab. But thanks to the doctors and nurses at Baptist Health and to the many prayers and thoughts from patients, family, and friends, I survived. Your cards, letters, and concerns were much appreciated. Due to my illness and the lockdown of the studio early in the pandemic, we went off the air. But we're back now. We have a vaccine. And I would encourage you all to get the vaccine. It's safe and effective. COVID affects our everyday lives. But in the show, there's other things than COVID that we'd like to talk about. There are other health care issues other than COVID that we would like to address. So while we will talk about COVID, we're going to talk about some other things also. And here to help me start that is Dr. Lee Hicks, an oncologist with Baptist Health Lexington. Welcome, Dr. Hicks.
Thanks for having me, Jeff.
Well, tell me, you're an oncologist as a cancer specialist. So with COVID, have you seen change in either detection, diagnosis, prevention of cancer?
Yeah. Early on in March and April of 2020, when we were still not sure of exactly how this was being spread and what particular measures we needed to take, and of course long before we had the access to vaccination, there was a understandable bent towards backing off on screening. You know, I mean, when you were not sure how or where you were going to get this early in this, there was a lot of folks who understandably just didn't want to get out, and doctors that were hesitant to have them going out. So when you look at our numbers just at Baptist Lexington alone, in March and April of last year, they had gone down dramatically from what they were in prior years in that same month of March and April of previous years. But by March and April of 2021, by comparison, we are pretty much fully back to normal. We had, by really the fall of 2020, started to make extra accommodations to try to make up for lost ground, where people were able to come in on weekends, later hours, for mammographic screenings, for lung cancer screenings. By that point, you know, having accommodations to be able to do colonoscopies and so forth, our ability to put people through procedures that not were just screening but were requiring sedation was not a big issue. So really, we are back up to speed, if not even in some ways we've learned to even become more efficient, and that's despite the fact that we have safely been able to return to norm by virtue of doing the things that all the world has heard 1,000 times. Vaccinate, distance as able, and wearing a mask for prevention of you asymptomatically spreading to others, being your brother's keeper. We do that in our facilities, and we are a very safe environment for people to come.
Have you noticed an increased number of cancer or increased prevention, more spread? Is it farther along because we put things off?
Part of that is hard to answer yet. You know, when we know that early detection is important for improvement of overall survival by virtue of catching cancer before it has spread. Some cancers are more aggressive, such as breast cancer, which is the most common cancer nationwide that we run into. And whereas our average stage of cancer diagnosis for breast cancer was probably in the stage 1 or 2, we are definitely seeing people who, because of anxiety for screening, are coming in with more nodes positive and more advanced disease, and then requiring more therapies even beyond their surgery than they might have otherwise.
Well, let's talk about, you mentioned therapies, and we'll maybe get to that, but before that, where does the COVID vaccine come into therapy for cancer?
So first of all, one of the most important discussions I have with patients right now is how to get them through not just the screening and not just the diagnostic procedures safely, but how do they get through their treatment safely. And a lot of the things, especially as a medical oncologist where I do things that suppress their immunity, we have to do as much as we can, if able, in advance of starting those therapies to have them ready. Their immune system is compromised by some of the things we do. Some of the treatments do it minimally. Some, particularly if your cancer happens to be in say a lymphoma or a chronic leukemia, that the treatment is going to keep the counts down for months on end and potentially abbreviate the benefit or the duration of antibody response. It makes all the greater difference of getting vaccinated early, and as now is coming up the need for boosters, because in people who are immunocompromised, we know that the antibody titers wane with time. It probably is waning quicker in those who are on therapies that suppress the cells that make those antibodies.
That's great information. We appreciate you coming in. So if you've put your screening test off, get your mammogram, get your colonoscopy, get your CT of the lung, talk to your primary care about a booster, and make sure you prevent cancers.
Yes.
Thank you, Dr. Hicks.
Absolutely.
Appreciate it.
Yeah.
We'll be right back.